Welcome back. If you're confused about what's going on with COVID, well, you're not alone. We're going to get into that in a minute. Meantime, for doctors on the front lines, it's a fight against time as the hospitals are quite literally overflowing. In Texas, they have built overflow tents to treat COVID patients. As you might remember, the governor there says no to mask mandates and is fighting lawsuits over the issue. And Florida is reportedly asking for more ventilators there. Governor Ron DeSantis signed a law that will fine businesses who enforce vaccine mandates. While in Arkansas, they report they are down to 12 ICU beds. And the governor, in a moment of reflection, says his light touch approach to COVID might have been, well, a mistake.
To make sure that we can look ahead and get ahead of the curve on ICU space. It is obviously very limited. Everybody has to realize this is not a good time to get sick because the space is limited.
All right, Dr. Catherine O'Neill, Chief Medical Officer of Our Lady of Lake Regional Medical Center in Baton Rouge, Louisiana, said her hospital is in your words, ma'am, the darkest days of the pandemic. What does that mean?
What we're seeing on the ground is just a swift escalation in the number of COVID-positive patients who've come through our doors in the last week, 2 weeks. So 2 weeks ago, when we kind of sounded the alarm and said we're starting to see an increase again, we had 36 patients in the hospital. Today we have 193, 9 of them children, most of them wholly unvaccinated, 50% of them less than 50. Just an incredibly different pandemic than we saw last year. And it's really the escalation of those cases that bothered us the most because we couldn't create beds fast enough and find staff to come in. Today at the hospital, what you'll see is a backup of care, ambulances lined up outside, and really sort of an unmantling of the safety net for the community, taking longer to reach each patient who's calling EMS, taking longer to find a test, things that we feared last year, we thought we had overcome, and now they're back to haunt us.
One of the arguments that people use against vaccine mandates is they say, look, if I am vaccinated, I'll be fine. And if I'm unvaccinated, that's my choice, and it doesn't affect anybody else. So let live and be lived. Let live and go on. Right. What I'm hearing from you, though, is that... I'm sorry?
Oh, no, absolutely. Go on.
Okay. No, I guess the question, though, is now, is the fact that there are so many unvaccinated people in your hospital mean that if I, as a vaccinated person, get into a car accident in Baton Rouge or have a heart attack or my mother has a stroke, it's unlikely that they're going to get the kind of top-tier care that your facility's used to giving?
That's right. That's exactly sort of what we're trying to get out to people today is we want people to make an informed decision.
What I understand, this isn't a warning.
Yeah.
This is actually happening right now.
Oh, absolutely. It's done. We warned 2 weeks ago, and now today we're just saying that you need to stay home, you need to put on your mask, and you need to get vaccinated today because it will take you weeks to develop the protection that we really needed several weeks ago. Today, if I have a stroke, today, if I have a heart attack, today, if I just break my leg, I can't get the care I need. It's not happening. It's not going to happen for weeks because we had so many positive cases over the weekend and today that we already know that next week is going to look even worse. We're out of oxygen tanks. Our oxygen is freezing. You can't go home on oxygen today because everybody is out of supplies.
Wow.
We never thought we'd reach this point, but we're here. And so now we're in a critical state of basically crisis. How do we get past it? Everybody's got to do their part. And when everybody does their part of that is vaccination. So our really tool right now is how do we inform people? Yeah.
It's terrifying. I want to just get your thought real quickly. So many politicians on the right have talked about your body, your choice. And then on the left, we see other politicians, Rashida Tlaib, for example. She was unmasked at a party, rolling around, dancing at a wedding. Almost looked like she was at Martha's Vineyard at Barack Obama's party. She wasn't, but she was out partying. I would imagine the rhetoric on the left and the right in these examples don't help you much in your cause.
No, they don't. And honestly, we stopped watching the news a long time ago as healthcare providers because all we see in front of us every day are patients. And so what we need people to do is to start listening to information about the vaccine, to information about their health, and doing the things that make them healthier, and to just cut through the noise because all of that, that's just noise. And on the other end of that noise is somebody who's sitting in my emergency room having a heart attack and not being seen today.
Well, as somebody who was in an emergency room in a fine facility such as yours with COVID and counting on people just like you to take care of them, I thank you and applaud you for the hard work and long hours. Thank you, ma'am.
Thank you.
All right. All the best. Up next. They declared